Okay, let's dive right into this explainer and map out your exact roadmap to passing the Omani examination for general practitioners. Look, if you're a doctor looking to step into the healthcare system in Oman, this is the very first and arguably the most important hurdle you need to clear. Today, we're going to break down the official Oman Medical Specialty Board booklet to give you total clarity on what to expect and, more importantly, how to conquer it.
Here is our roadmap for today. First, what is the OEGP? Then, eligibility and registration steps. After that, the exam format explained, breaking down the blueprint, a quick test of your knowledge, and finally, study references and results.
Section 1. What is the OEGP? The gateway to practicing in Oman.
So here's the deal with this exam. It acts as a strict safeguard. The board isn't just looking for human encyclopedias, you know? They actually want to evaluate your practical ability to diagnose and manage conditions safely before you ever enter their local healthcare system. They designed this whole thing specifically to assess your critical thinking. They want to know for sure that you can utilize diagnostic procedures appropriately, prescribe the correct medications, implement vital prevention strategies, and, above all else, prioritize patient safety. In short, it's the ultimate eligibility test to prove you're a competent GP ready for employment in Oman.
Section 2. Eligibility and registration steps. Passing the gatekeepers.
Before you even think about cracking open a textbook, we need to talk prerequisites. There are two absolute requirements to prove you have the foundational medical background for this. First, a Bachelor of Science in Medicine from a recognized local or international medical college. And second, successful completion of an approved or accredited internship program. Once you check those two boxes, you're officially eligible to step up to the plate.
Getting registered? It's actually a super straightforward four-step path. You'll start on the official OMSB website and just click on Professional Competence Affairs. From there, select Occupational Classification Testing and navigate over to Online Services. For the actual booking part, the system is going to direct you right to the Pearson VUE website. That's where you can schedule, reschedule, or even cancel your exam if you need to. Finally, to officially lock in your appointment, you'll pay the $220 examination fee.
Now, here's the really great news about how accessible this process is. If you're already residing in Oman, your testing venue will be right there locally at the Oman Medical Specialty Board. But if you're applying from abroad, no problem at all. You have the incredible convenience of taking the exam at designated Pearson VUE centers located literally all over the world.
Section 3. The exam format explained. Decoding the beast.
So what are you actually walking into? You're going to be facing exactly 150 single best answer multiple choice questions. This is great because it means no complicated, tricky multiple select formats. You just read the clinical scenario, evaluate your options, and pick the single most appropriate answer. Time-wise, you've got 2 hours and 45 minutes to knock this out. If you do the math, that breaks down to just over 1 minute per question. You're definitely going to need to explicitly balance your speed with careful reading, making sure you don't get bogged down and waste time on a single tricky scenario. And here it is, the magic number, 60%. That is your target passing score to achieve victory. You don't need to be absolutely perfect, you just need to demonstrate a solid, safe foundation across the board.
Section 4. Breaking down the blueprint. Where to focus your study hours.
All right, look at this breakdown, because this is basically your cheat sheet. A massive 39% of your exam focuses entirely on medicine. I mean, that's huge. This is where the vast bulk of your study time absolutely must be spent. After that, surgery takes up 18%, women's health is 13%, and emergency medicine sits at 12%. The remaining 18% is a combo of public or community health at 11% and child health taking up 7%. Now, the board does note this distribution might fluctuate by up to 5% in each category, but the overall strategy here is crystal clear. Spend your hours where the points actually are.
Now, a quick heads up. The source material is incredibly particular about its definitions, especially when it comes to prevention. You have to clearly distinguish between the three stages. Primary prevention means intervening before health effects even occur. Secondary prevention is all about early screening to identify diseases right at the start. And tertiary prevention, that's managing a patient post-diagnosis to prevent further impact or disability. Getting these three tangled up is a really easy way to lose precious points on those public health questions, so get them locked in.
Section 5. Test your medical knowledge. The mock battle.
Let's wake up those clinical reflexes right now, okay? Picture this clinical scenario. A diabetic, hypertensive, and dyslipidemic 56-year-old man presents to the emergency department.
He had an acute onset of left-sided upper and lower limb weakness that lasted for exactly 5 minutes, but then he had a complete recovery. Your job is to identify a specific predictor for the risk of him developing permanent symptoms within the first 7 days after this presentation.
So which of these 4 options is the single best predictor for developing permanent symptoms? Is it A, age under 60, B, the duration of 5 minutes, C, the presence of dyslipidemia, or D, unilateral limb weakness? Take a second, think it over, and lock in your answer.
All right, if you went with option D, unilateral limb weakness, you absolutely nailed it. It's exactly these kinds of highly specific clinical nuances, separating a strong predictor from just general risk factors that are going to fill your time on test day. They're actively testing your real-world ability to stratify risk and transient ischemic attacks to guide your next clinical steps.
Section 6. Study references and results. Crossing the finish line.
So what are the best weapons to prepare for this thing? Well, these are the official heavy-hitter textbooks recommended by the OMSB to build your study foundation. You've got the Oxford Handbook of General Practice, Current Diagnosis and Treatment in Family Medicine, Practical of General Practice, the always renowned Merck Manual, and John Murtagh's General Practice Collection. On top of that, they specifically recommend referencing the Ministry of Health manuals and the British National Formulary for Pharmacological Management. If you ground your studies in the breadth of these texts and align them tightly with that test blueprint we talked about, you are going to be in incredible shape.
Honestly, the absolute best part about this whole computer-based setup is that the agonizing wait really isn't agonizing at all. It's incredibly short. Your results will land straight in your inbox within just 24 hours. You take the test, you walk out, take a massive deep breath, and by the very next day, you get an email at your registered address letting you know if you've hit that 60% mark.
As we wrap up, always keep this core idea in mind. Every single question on this exam is designed for one purpose: to test your ability to be a safe, effective, and critical thinking practitioner. Again, they don't just want medical encyclopedias. They want real doctors who can actively evaluate signs, choose the right investigations, perfectly balance pharmacological and non-pharmacological interventions, and prioritize patient safety above all else.
Well, the mystery is totally gone. You've got the roadmap right in front of you. You know the prerequisites, you understand the blueprint, and you know you just need that 60% benchmark to unlock your medical career in Oman. So the only question left for you is, how soon are you going to schedule your exam and step into your new future? It's time to dive into those studies, hit that medicine domain hard, and go prove your competence. You've got this.